COVID-19 recovery, helping Hoosiers recover financially, physically, mentally, and socially through services provided by Community Action of Greater Indianapolis. Services include energy assistance, child care, family support, education, training programs, and food assistance. COVID-19 recovery.
Hi, I'm Kelly Vaughn, and welcome to COVID-19 Recovery. And today we've got a very interesting topic, wellness in the church. And joining me is my co-host,
Al Bracken. Good morning, everyone. I wanted to remind everybody, and I know we have some pretty loyal viewers that watch the show every week, but I wanted to remind everyone about what CAGI is doing and why CAGI is a sponsor for this particular program. CAGI, as part of the CARES Act, has started a wellness initiative called the Community Pandemic Wellness Initiative, and it's based on a mind, body, and soul approach to wellness. And as part of the soul component, and as it relates to the mind and the body, but the main part of our soul component is working with a group, a rather growing large group of pastors, ministers of all faiths and denominations in Indianapolis. And in doing so, we were absolutely positively blessed and fortunate to have as our lead pastor, Pastor Bruce Farr of Overcoming Church.
Thank you guys for having me.
Pastor Farr, can you tell everyone a little bit about your church, your ministry? And I know you're located at 2203 Columbia in the heart of a vibrant community. But can you tell us a little bit about yourself, a little bit about your background and your ministries over at Overcoming?
Sure. We established Overcoming Church about 29 years ago. And we've been in the location we're in now for about 26 years, 27 years now, the Martindale-Brightwood area. We're right there by the Monon Trail. And our vision is connecting people back to God and then connecting people with people. So we look for different ways in which we do that, either through worship or through needs in our community, how we can connect people to resources, how we can connect people to things that are needed that they may not have access to. So that really is kind of what drives everything that we do, is about being relational intentionally. So last year when the COVID was shutting things down, I noticed that a lot of people in our community, especially last year, in and out of different department stores and establishments, retail establishments, just didn't have masks on. So we worked with an organization then to make sure people had masks when masks were not readily available last year. So making sure that people have access to resources that may not be readily available is really part of how we try to connect with people as well.
Absolutely. And doing so, and I'll repeat this again, Pastor Farr has been an absolute blessing to CAGI and the group of pastors that we're working with, because it just so happened that his philosophy he has a wellness ministry that's implanted mind, body, and soul at Overcoming Church, and it was just great to be able to still be in the ongoing phase of learning from Pastor Farr. Pastor Farr, can you tell us about the message of wellness and the importance in the church and your philosophy on that?
Absolutely. Wellness is a component. It's an element of salvation, we believe. And the word salvation simply means to be made whole. So when you think about wholeness, it's not just something spiritual, but emotionally, relationally, socially, economically. And so we believe that Jesus Christ came to minister to the total man. And our physical bodies are the temple of God. So we believe that part of our relationship with God is becoming healthy and whole in every area.
I want to remind everybody again, mind, body, and soul. Okay, mind, body, soul. And one of the reasons we wanted, which was a no-brainer, that as part of this wellness initiative from CAGI was to look at the thought leaders in our communities of color. And that led us to our pastors because of the influence that our pastors in the Latina community, in the African American community, in the international community, the influence that our pastors have over their congregations. And this has been a overwhelmingly enlightful for us to be able to have access to this group of ministers, because we as an organization are truly learning from the experience. Pastor Farr, I've been over to the church when you've had your services outside. That it absolutely fantastic, for lack of a better word. I loved it. I love the feel, the spirit, etc. Can you tell us how COVID-19 has affected your congregation and your ministries?
Sure. So while we were a part of still trying to hear and learn what was going on with this unknown thing that was going on in our community, we began to notice that disproportionately people of color were being affected 3, 4, 5 times more than other cultures. We were dying at a much higher rate as well. And so that became alarming and disturbing, because at the heart of that were underlying issues that we as a people of color in general, have that made us more vulnerable and susceptible. And so that was kind of one of the reasons why we felt it important, along with misinformation and mistrust that was going on in our community. We felt it important that the church also be a voice, because there were many narratives. There were many, we've politicized this thing now, and it's really not about politics. It's about our community. It's about people's health overall. So we began to understand that the coronavirus is an epidemic. It's more than just about the individual or our political issues. This is a community issue. And because the church is a community, we have a responsibility of loving and caring for our neighbor and our community. And that involves not putting each other in harm's way. People that felt like, that they were not going to be impacted. A lot of people could be asymptomatic. I may be asymptomatic. So regardless to what I kind of believe or felt, I don't want to put my neighbor in harm's way when I get around other people. So it was important. I may not have symptoms, but I still may be transferring and giving it to someone else. And I think that goes against the message of loving my neighbor. So we're trying to make sure that we understand that it's not just about me as an individual or you as an individual, but rather it's about us as a community.
Well, it's interesting you say that. I had a gathering here at the house a couple of weeks ago, and it was a couple of young people. And what I have found is there's not even a political divide anymore. It's more just people have their own philosophy. So the young people versus the older people, or maybe the left or right, but people that are, say, opposed to the vaccine or have skepticism, it's a mix. And
absolutely.
And so, but the young person was saying to me, well, I probably couldn't get it anyway, and I'm going to be okay. And then when I started explaining to him, like, yeah, but you could still have it and unknowingly pass it on. And he kind of looked at me like he had no clue as to what I was talking about, which told me a lot of people just aren't watching. They're not watching the news. They're not paying attention. And maybe some of that is, when we grew up, our parents sat down, they watched ABC nightly news, but younger people, because it's the social thing, media thing, is really what you want to watch, and not necessarily, news was kind of forced on us. When you were home, you watched television. So I'm looking at this kid like he has no clue as to what a lot of people don't know, or it's who you're watching and what they're saying about it.
Absolutely. Yeah. And there are a lot of different outlets and sources that are driving narratives also. And so those are the things that people are flocking to and listening to as well. And the thing is everybody's entitled to their opinion, as you said. I think it's just about making sure that we give people tools to properly research so that they can really have come to right conclusions and proper conclusions. And I'm not sure if that is always made available about how to critically think when it comes to things like this as well.
I think that's absolutely correct. And in a lot of the outreach work that we're doing with the CPWI program and CAGI, a lot of grassroots contacts. And what we're seeing, or we're starting to see, is that there are cultural differences in why folks aren't getting the shot, where some of it is when we partner with Shalom Clinic and their RV is on site, it's just a matter of individuals walking out of their domicile or wherever they're at in their apartment and getting the shot. We still encounter, and I thought this was interesting, we still encounter a group that they're anti-vaccine, period, not just the COVID vaccine, but I've encountered a few individuals who won't get the flu vaccine, they won't get any kind of vaccine. And those individuals are kind of set in stone on being an anti-vaccine, not just because of COVID. But what we're running across is just a lot of individuals that are getting, like Pastor, like you said, wrong advice from individuals and the lack of access to the shot. And that may sound strange because everybody's given the shot, but still we're running into procrastination and everything else when it comes to that. So the frequency, the number of times that we're out giving that shot is what's important. And Pastor Farr, with your good work with the CPWI program so far and leading up the Pastors Roundtable, can you tell our audience a little bit about, or a lot about, whatever you want to say about the Pastors Roundtable and what that is?
Sure. Well, when CPWI and CAGI first approached me, we were already really looking at ways in which we as a church could just start really using this as a springboard for our overall health. Our concern is not just about the COVID-19, but our overall wellness. And so I began to start talking to several pastors, and when CPWI and CAGI started having some dialogue, we began to find out that our church was not the only, as a pastor, I wasn't the only one that had concerns. So we wanted to look at bringing a roundtable together, a pastor's roundness well table, discuss what would the best practices be for addressing not just COVID-19, but other issues related to health and wellness. Because I don't believe that while we're going to feel the effects of this long afterwards, I don't believe this is going to just be the main issue where we're concerned. So we start looking at how can we address our underlying issues. You know, a lot of people are passionate about the shot and not the shot, but nobody's as passionate about obesity. Nobody's as passionate about high blood pressure and cholesterol and all the other things that are make up the things that contribute to certain populations of our country being more susceptible. So it was important that we provided a more well-rounded message so that they didn't kind of polarize us. When we first started, it started polarizing people about the shot and not the shot. So we decided, let's talk about overall wellness. And that way, overall wellness should be something that we can all be concerned about. So the roundtable consists of about 15, 17 pastors, and it's growing. Consists of us coming together, talking about what our concerns are, how we can craft narratives to communicate to our congregations and our community around our churches to help them to be better equipped and better prepared. It's also a place where we can talk about our just overall challenges that we're having with talking and communicating about it. Also helping pastors to provide access to information as well as other health-related resources. So that's kind of what the roundtable is in its infancy. It's really kind of us coming together and talking about what we using our platforms to inform our congregations and our communities around our churches.
Okay, well, We're going to take a break. We need to take a break, and when we come back, we'll finish our discussion on that panel. And I guess one of the questions in my mind is a lot of it is related to diet, and how will people receive that? Because as you know, food is a big part of everybody's church, everybody's community, and everybody's family. We'll have more on that when we come back.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Contact your local community action agency serving Boone, Hamilton, Hendricks, and Marion counties for help during the COVID-19 emergency. We can assist with masks, hand sanitizers, food, shelter, transportation, and more. Apply today.
COVID-19 recovery and having a discussion with Pastor Bruce Farr of Overcoming Church. But before we jump back into that discussion, I want to make folks aware of something that's going on very special. Breast cancer survivors have their moment in the spotlight at the Pink Ribbon Connection Stars of Pink Fashion Show. Saturday, October 9th from 10 a.m. to 2 p.m. It was downtown Marriott at 350 West Maryland Street. Connection Stars of Pink Fashion Show. So check that out.
Excellent. Thank you, Kelly. Let's get back to our guest this morning, Pastor Farr of Overcoming Church. And before we went to break, Pastor Farr was telling us, we were talking about the Pastor's Wellness Roundtable. And again, I'll remind everyone that Pastor Farr is our lead pastor with the CPWI program, the Community Pandemic Wellness Initiative. Pastor Farr, can you tell us, continue your conversation about the Wellness Roundtable, and where do you guys meet? Where does the group meet, and how do you meet? And can you tell us a little bit more about that?
Sure. We meet online. We do a Zoom call every 2 weeks, and we're kind of laying out the structure of this thing. We've kind of put together a positional paper on our basically what we as a group are communicating and where we stand at regard to the COVID-19 virus and what our plans are for moving forward with it. We spent some time now hearing from pastors about what they would like to see as a wellness ministry, because we want to be able to provide something to pastors long after the COVID-19, the pandemic piece of this is over. We want to be able to put some things in place for churches that pastors can speak to and address overall discipleship, because we believe that health and wellness is a part of our discipleship walk with God and our relationship with God. So equipping them with tools, equipping them with resources, allowing them to have blood pressure screenings in the trucks that come out and all of those kind of things are what some of the things that we've been doing. We're still in a gathering stage where we're learning what everyone's concerns are. We're learning what everyone's passions are, because there's no template for establishing health and wellness in every church. We're learning what everyone's passion is. And we find out as we went around, some people's passion is about health, is about mental illness. Some is about breast cancer. Some is about colorectal cancer. So we some are about grief and loss. So we have and then some are about just making sure that people get to have counseling just around challenges that they're facing. So we're trying to make sure that each pastor, the Wellness Roundtable, is able to tailor it to fit and meet the needs of each individual pastor as well, because people tend to give more energy to where their passion is.
Okay. But then a lot of those challenges, though, physically, when we all know, come from we are what we eat. And so that was one of the questions I was saying going into the break was, how do you overcome, so to speak? Because, we have our habits. We like what we eat, and getting people, that's, as we all know, it's hard to, whether it's losing weight or changing our diets, talk about high blood pressure, even cancer, oftentimes diet related. Man, that's a, how do you all plan to take on that challenge?
Well, we believe that change happens in the midst of community. When you start creating a community, it allows you now to create a culture. Because as you said, food is a part of our culture. Unfortunately, unhealthy eating is also a part of our culture. So you start creating a community where there's intentional support, there's information, there's biblical teaching, and then there's small group settings that allow people to have accountability, that allows people to feel like they can begin. You can when you're around other people that can help you walk through it, that can help you through this process, then that's when it becomes, that's when change happens. So it doesn't happen overnight, of course, but because we didn't get this way overnight. So you have to begin to start putting some steps in place with teaching, with instruction, with modeling of behavior, and giving people access to either a class to sign up for, giving people access to things and tools and resources. And it begins there. So that's kind of what we are, our approach is creating a community within each church, because change happens in community.
And I'll also comment on that. And the beautiful part, and Pastor Farr is being modest in the progress that he's made in such a short period of time. The beautiful part of what I'm seeing in the movement of the Pastors Wellness Roundtable is the continuity that he's building within a lot of different churches, a lot of different denominations, a lot of different ministers. And we all understand the art behind bringing these ministers together. They're all leaders in their own rights. And to be able to be a leader among leaders has just been exceptional. And what's outstanding, again, is the continuity throughout the different churches. So, Pastor Farr, can you tell us about October, Wellness Month in October? Now, everyone get your pen and paper out for this one, because this is a powerful month of October. And the churches are already have things planned. But Pastor Farr, tell us a little bit about Wellness October.
So part of the thrust and the launching kind of health and wellness is going to start in the month of October. And we've allowed each church to design and host certain events in their individual assemblies and congregations, doing sermons around wellness, putting out literature and information around wellness. Many pastors are going to be having a wellness Sunday around a certain theme. And then they're going to have resources and providers, service providers, actually in their church right after service is over with, so people can have access to that. Screenings, other resources. Some people are doing health fairs on Saturdays. Some people are doing services doing things in messages on Sunday, and then they can go out and get their blood pressure checked. The awesome other thing that I'm so grateful for CAGI with is they're allowing us to also, they're providing access to get people that don't have insurance, the Medicare, Medicaid issues, people that the last health fair that we hosted at Overcoming, there were people that had stopped taking medication and stopped being able to get prescriptions filled. CAGI was able to help them get reconnected. So the beauty of this is Wellness Month in October is about making people aware of how important it is. And we're modeling it in our individual congregations throughout the month of October. So we're really excited about that, because it lets people know that I think that when people see that this is a value of the church, it becomes a value for them as well.
As far
Al,
go ahead.
I'm thinking we're probably running pretty close on the clock based on my watch. So we probably, have to start wrapping it up. But go ahead. You started to say something.
Well, because it looks like we got about 3 minutes left.
Okay.
I was going to ask Pastor Farr about how other churches and organizations can get involved in Wellness October.
Sure. See, so right now we're in the process of putting together a website and allowing churches, they will be posting what their events and different things on the website. Right now, I believe it's going to be CPWI will be the website, Facebook.com, CPWI. Can also be if you're a pastor or a faith organization wanting to get connected. So you can reach me at overcoming@yahoo.com. We're just excited about empowering our pastors so they can empower their people. Our whole thrust is we want to empower pastors to empower their people. And we believe that this becomes a way in which everybody can win in this. Everybody can win.
Kelly?
No, we appreciate you coming on. And of course, I had a lot of other questions, especially the one with, a lot of people, the issue on vaccines is the assumption that God will protect us. So you'll have to come back to talk about that. It's a loaded question.
Absolutely.
Why do I need it? God is going to protect me. But yeah, and that's kind of like looking at it all from a church perspective. But we do appreciate you coming in and sharing with us. And so will you come back for sure?
Absolutely.
Okay.
And the vaccine is nothing new. I mean, that's an issue that's nothing new. We've dealt with that from seatbelts back when seatbelts first came out. Everybody fought hard against that. And we see where we are with that. But that's not a new topic or a new issue.
Yeah, and I wouldn't go anywhere without it. In fact, now it doesn't feel right not to have it on. And it's funny how that's switched. And it has been proven it does save lives. So thank you so much for joining us. I'm Kelly Vaughn.
And I'm Al Bracken. And again, thanks, Pastor Farr, for all the good work that you're doing.
Thank you.
And thank you all for watching COVID-19 Recovery. We'll see you next time. Bye-bye.
During the COVID-19 emergency, community action agencies are open and here to ensure the well-being of families across the country. For over 50 years, we've been delivering life-changing services, solutions, and stability.
Serving Boone, Hamilton, Hendricks, and Marion counties, be sure to visit our website to learn about employment and education opportunities, food, housing, transportation assistance, and more. Apply today by calling 317-396-1800.
COVID-19 has changed how we spend weekends with the girls. Now it's time to take the first step that lets us get back to brunching instead of late-night munching. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Should I get it? Is it safe? Should I wait?
It's okay to have questions. Now get the facts at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.